Howdy everybody, this is Keith down at the Glen Rose Medical Center. I'm a physical therapist. Today I'm going to do a demonstration on some dry needling. We use dry needling a lot here in the clinic to help with pain of all kinds. It's very effective in getting pain down pretty rapidly. That's why we like it so much. So today my kind boss is going to let me do some demonstration needling on her. So we're going to do a little bit on her neck and her shoulder rotator cuff, because those are so often intertwined and causing some pain for folks. So here we go. So for the first one, since she's having a little bit of neck trouble, we're hitting some of her cervical paraspinals right here. There we go, nice and easy. And then we very commonly hit the patient's upper trapezius, or trap for short. It gives a lot of people pain. I felt a little twitch there, which is pretty common, especially when someone's a little flared up. Good, oh yeah, there it is. That muscle right there is a little angry. Okay. A lot of people ask, does it hurt? Sometimes when you hit a sore spot, if you feel it, but I think most people will agree that it helps with the pain at such a significant level that it's worth the brief trade-off. So now I'm feeling along her shoulder blade here, and so hitting the bottom part of her rotator cuff, the infraspinatus muscle here. Yeah, that one twitched too. And the infraspinatus goes pretty far, so I usually hit it twice. Same thing, kind of palpate along that spine of that scapula. Yeah. There we go. And then last one we're going to hit right here, because again, I find commonly that people whose neck and shoulder bother them, chicken or egg doesn't really matter, but they end up with a lot of trouble in one or the other, even though they may not present as one. So I try to really take care of that rotator cuff. There we go. Now, once we get them in, typical treatment's going to be about 10 minutes long, give or take. One of the things we can do is we manipulate them manually with a little turn or just a little light pistoning, as we call it. And then we also can use our point stimulator. And our point stimulator, for those of you that have had electrical stimulation before, or a lot of people have a TENS unit at home. Same principle. We've got some electricity, but now we've got a couple different points we can put it on. So we try to start a little low. You feel that, Tammy? So we try to turn up just enough to get a little feeling, perhaps a little jump in the muscle, but nothing too severe. Yeah, you can. I don't know if the camera can pick it up just quite, but yeah, there you go. You can see it jumping a little bit. And so what we're trying to accomplish there is getting that muscle to relax. It's a little bit of fighting fire with fire. Whenever we've got a muscle that's in spasm, yeah, there's that one. That's a rotator cuff there, our infraspinatus muscle. Whenever we've got a muscle that's in spasm, it just won't relax. And so what we're trying to do is hit it with a needle to get it to decrease motor end plate activity, kind of knock it out of that loop, so to speak. And the E-stim accelerates that. And a good twitch on that one. And we just typically are going to rotate this around for about a minute at a time. Not the full 10 minutes, usually put them in, give the person a minute to get used to them a little bit. Hit them with the E-stem here for 3 to 5 minutes as we rotate it around. And then I'll do a little bit of manual manipulation, and then we take them out. And then after that, then we do our other therapy activities, exercises for strength, exercises for stretching. If we were going to do any other manual techniques, joint mobilizations and whatnot, we usually do this fairly early in the treatment to try to get things loosened up. Probably hit this one more time around here. Little jump there. So then I'll show a little bit more of this here. You can see she's getting a little red around there. That's pretty normal. That's actually a good thing. It means we're getting a little extra circulation there. People with lighter skin will get even redder. We're just trying to get into those tight spots, get them to calm down.
So Keith, how often would you do this?
So typically, this is a treatment we're going to do 2 to 3 times a week. What I've found practically is that when I get people in soon after their injury, say the first couple of weeks or less, they're not needing many treatments at all. Somewhere between 3 and 6. People who have a little more chronic problem, it's going to take a little bit more, but usually 2 to 3 times a week. Typically somewhere between a dozen to on the more standard end of treatments. Someone who's really got a significant problem, we may hit 15 or maybe even a few more than that, but usually this is going to get there a little quicker, especially again on those folks that can get in here pretty soon after their injury. So how about I show people, so when we just take them out, they just kind of spin on out. These are very small. These particular needles are 0.3 millimeters in diameter, so they're quite thin. Nothing at all like a hypodermic needle like you might see when you're getting an injection. Your flu shot, even a flu shot needle is pretty small, but these are even smaller. Flu shot, other injections, certainly nothing like a blood draw. Those are pretty large. Oh, and the little spring tip on there, that's the little metallic portion that we use. That way it conducts the E-stem whenever we use the point stimulator. And that's it.